Emergency orders also dealing a financial hit to medical professionals. Valerie Gonzalez with the details and the end to a streak in Starr County. Valerie.
The 8th case of COVID-19 was reported today in Starr County, a man who went out of town and came back sick. Yet there are no cases of local transmission and no deaths reported here so far. It may seem like a paradox, but it may work against this hospital financially. Hospitals are in the business of treating the sick. When resources shifted to COVID-19, Starr County Memorial Hospital started noticing missing clientele.
We did not want to expose our personnel to the potential risk of infection from COVID-19 patients, as well as we needed to protect the PPE.
This was part of the governor's orders issued March 22nd. It kept hospitals from performing surgeries and procedures not medically necessary to correct a serious condition or save a life. Dr. Jose Vasquez, who sits as president on the hospital board, says they began seeing fewer patients and less money.
Definitely, elective procedures are a significant part of the money that comes in for medical procedures or for medical services that we provide here in our communities.
It's hard to know right now how much it will affect them. The hospital runs with revenue that comes in 2 months back. Vasquez says they expect to know the full impact around June, but they already started bracing for it.
We have had to make some adjustments in the schedules, and some hours have been cut short. However, every employee has kept his job.
State and federal government are making funding available for hospitals like this one. In Starr County, where the awareness has been high and the cases low, it can hurt their chances at receiving funds from the CARES Act.
In our case, we didn't have any COVID-19 patient admitted in our hospital, so we will not be eligible for those specific funds, but we are being eligible for other resources that the federal and the state government have put in place, and we have already received some of those funding.
The hospital district operates with funding from taxpayers. Vasquez says in the 6 years he served on the board, there hasn't been a need for an increase. Not now.
This was to prolong significantly throughout the time, and more patients were getting affected, and a second wave was to affect our communities. Then we will have to take the decisions needed at that point.
Vasquez believes there is reason to be optimistic. The governor lifted the suspension on the elective procedures last week. Starr County Memorial Hospital plans to start offering them again this week. They're hoping it will help their bottom line, but they're also planning on how to protect the patient. Vasquez says they are thinking about administering a COVID-19 test before the patient is admitted. In Starr County, Valerie Gonzalez, Channel 5 News at 6.